Good afternoon, Linda. Thanks for joining us today on the Workplace webinar series. If I may, could I just have you just introduce yourself and tell us about your role in public health?
Sure. Hi, my name is Linda Cottler, and I'm the Dean's Professor of Epidemiology here in the College of Public Health and Health Professions. Also, because I'm in the Department of Epidemiology, we're also in the College of Medicine. And I'm the Associate Dean for Research in the College of Public Health and Health Professions.
Wow. Yeah. So a lot of big responsibilities there. And so with, as everything kind of connects to health and wellness, we just want to get kind of like your take on, we are recording this on April 28th, 2020. So what are some themes that you think are kind of emerging from, everything associated with COVID-19, as we've all been about a month now in social isolation, social distancing.
Right. My biggest concern is for health disparities.
Okay.
In the underrepresented populations, I am concerned about the disparate, just the differential mortality, the differential impact of the
Hmm.
virus on these other populations.
I see. So I think the large public health intervention is social distancing. Is that maybe not effective for some of the more sensitive populations?
Um, I don't know how to answer that question, but I'll answer it the way I think that you intended it to be.
Okay.
And that is that physical distancing is difficult for some occupations, and
Hmm.
some occupations are more prevalent with certain populations.
I
So, for
see. Okay.
example, people on the front service line, they may be more likely to be minority populations. And so they may not have any choice but to
Hmm.
show up for their job.
Right.
Whereas others of us can do some of the things from home, and we have the
Sure.
luxury of doing that. So
Right.
I'm worried about the comorbidities that minority populations have at higher rates, which
Hmm.
also puts them at a greater disadvantage for COVID virus.
Hmm. So yeah, there is a bit of a concern then for those of us that maybe a uh, more of a first. Oops, sorry, my microphone came unplugged there. So it becomes more of a
Nick, your microphone is no
oh,
longer.
there we go. Sorry, it unplugged and it muted. So let me try that again. So thank you for that. Um, right. So there are certain occupations which I think directly relates to the theme of kind of workplace wellness. So I could definitely see how if you're in a position and you have an occupation where you can't physically distance, that's going to affect all areas of kind of mental health and well-being in the workplace, and then for lack of a better term, how well supported you feel by your employer and all these things. Could you speak to any of those, maybe kind of downstream effects of individuals who do work in occupations who can't socially distance? Are there any associated um, risks or issues there that you've seen?
Well, we know from studies in epidemiology that there are occupations that have higher rates of comorbidities.
Mm-hmm.
And it could be because you're sedentary. It could be because of those kinds of other or behavioral issues. And
Mm-hmm.
so those are things that we worry about. And that's why at HealthStreet, which is our community engagement program here at the university, we're
Right.
really trying to give everybody a voice in research, and also
Mm-hmm.
trying to connect people to medical and social services so that we can reduce this disparity in these
Mm-hmm.
populations. And that way we can try to make things more equitable
Mm-hmm.
But there's also problems with access to care as well.
Right. Yeah, I've heard multiple times health equity um, being an issue for access to proper medical care and opportunities to reduce certain risk factors. Could you speak a little bit more about your HealthStreet activities? Are there any recent developments? Recent COVID-19 projects that you're involved in?
Yeah, early on, we thought we would change a little bit about how we are connecting with our members. And
Mm-hmm.
just as Health Street in the beginning, we really tried to change the culture of community outreach. Now,
Mm-hmm.
during COVID, we're trying to change the culture of community engagement and outreach by, we can't go out and talk to people face to face. So we
Sure.
have a Reconnect campaign
Mm-hmm.
where we're calling all of our members and just telling them, look, we're still here for you. We're not turning our back on you, but we can't serve you in the same way we did before. But
Mm-hmm.
one afternoon a week or 2 afternoons a week, we are available and we are open
Mm-hmm.
at the Health Street site. And we can help you with certain things like we have some food distribution. We have some naloxone, Narcan
Mm-hmm.
nasal spray for opioid uh,
Sure.
overdose reversal. And we
Sure.
can also give people toiletries, and we have a clothing closet, and we're still giving referrals. And
Mm-hmm.
so in addition to that, we're asking them to answer a few questions. So normally when we do our Reconnect campaign, we're asking people if they've changed their phone number or their address, and we're
Mm-hmm.
asking if they'd like any more referrals or if they'd like to hear about research.
Sure.
This time, in addition to that, we're asking them a few questions. One of them, several of them are about COVID. Have you tried to be tested? Have you been tested?
Mm.
If you've been tested, are you positive?
Right.
And then we're asking about their stress level, their loneliness level. If they have depression or anxiety, we're asking them about their binge drinking, about medications, and then we're asking them their top health concerns. And also, are there any things that we can do for you that you might need? So we're compiling all this information, and we're trying to understand more about the effect of this um, physical distancing, social isolation
Mm-hmm.
on our members.
I see. So, just so I understand a little bit. So, when the Reconnect campaign, that'll be members of Health Street staff. Are they calling people on the phone and then updating the information and asking these additional questions?
Yes, that's right.
Okay.
They're
Yeah.
doing this because we can't, see people face to face.
Okay.
And we've got an overwhelming response. They
Oh,
said,
great.
keep doing what you're doing. It's a really good thing. Um, we've gotten some phone numbers, as I said, that didn't work. For the most
Sure.
part, people are really excited to
Hmm.
talk to us and tell us what they think.
Sure. And just so for people that are watching this video, Health Street, who does Health Street primarily serve? What's the population?
Well, we serve people, and
Oh,
so
okay,
we
great.
serve anybody.
Anyone,
But
okay.
but it really has been primarily focused on the underserved populations,
Hmm.
underrepresented populations, because we're a research group. And so what we're
Okay,
trying to do is to link people to the coordinators at the university to give
hmm.
everyone a voice in research.
Sure,
And so we're trying to make the research enterprise work for everybody. So we're connecting people to the researchers, we're connecting the researchers to the people so
sure,
that we can try to get everybody involved. Because what good does it do if all your treatments and interventions are based on one class of people or one
sure.
race or ethnicity?
Hmm.
It doesn't help, because when you give those interventions or you give those medications to the population and they
Sure.
haven't been tested, we see
Hmm.
all kinds of different things that don't work right.
Right. So the Reconnect campaign, it sounds like you may be uh, you might stay with the direct phone calls. If you've had such a good response and the community has been very receptive to it.
Well, it's a Band-Aid. It's a way to continue to connect and make
Sure.
people realize we're still there. But in the
Hmm.
long run, it's face-to-face connections that really,
Okay.
that's what's really the important part about
Sure.
health and wellness is your relationship with each other.
I see. Yeah.
And while we can definitely relate to people on the phone and through Zoom, there's
Hmm.
nothing like, you know, a a um, a face-to-face contact.
Hmm. Now, is it possibly in the plans to introduce maybe a socially distanced face-to-face contact as a, what the new normal may look like? Because I see that as, being a possibility. Is that
Yeah,
is that an option or a plan in the
I
future?
I do think that this is going to be something that we're all going to have to consider. And
Hmm.
I work on another study
Hmm.
it's called the ABCD study with
Okay.
Dr. Sarah Jo Nixon from psychiatry. She and I are the PIs of the study, and it's started out with 10-year-olds, and
Okay.
there are 20 different institutions around the country. 10,000 10-year-olds were studying for 10 years.
Wow.
And we also have to do we're doing an MRI with them, but we can't do that right now. So we've had to find ways that we can connect every 6 months with these youth and their parent. And
Sure.
so right now we're making a whole long list of all the things that we think have really affected not only the retention of these families over time, but things that are going
Hmm.
to affect recruitment over time for new studies.
Hmm.
Things like venue paranoia. People might be paranoid to come into a hospital
Oh,
situation.
sure. Right.
Um, or maybe they might want to participate in studies more now because they need the money. Um, but also, there are
Hmm.
other things that we might be able to do with youth that they might not want to do this anymore. They might want us to do this totally by phone. So we think of ways to remunerate kids.
Hmm.
We might give them an iPhone for a while and see how that works. But there's a lot of things that we're starting to think about
Sure.
that's a result of COVID, and it's to continue their health and wellness. That's what's
Hmm.
really important, right? Is to
Right.
keep people healthy and continue to find ways that we can connect.
Hmm. Yeah, it would be an interesting it'd be an empirical question, to think about, okay, all the different mediums, right, with different age groups. And then, my thought before you shared, your current um, questions to think about in that
Mhm.
project was, how do we, what's kind of the shaping process to get people back into that health to health or that face to face interaction, if we know
Yeah,
that's a very effective component, a very important
yeah.
component of any type of treatment, that maybe it's
Mhm.
phone call, which leads to a Zoom, which leads to a walk-in session, but it's, behind a glass, glass
Yeah.
wall. And then once whatever social distancing looks like in the future, then does removing that physical barrier, does that have an impact on um,
Yeah.
all the related issues there? So um, now, when you talk about these different, manipulations when working with the youth over the next 10 years, um, what would be um, any anticipated barriers you would see with this long-term project as it relates to being in the pandemic now, to post-pandemic, post-social distancing, whatever that looks like?
Well, I think it's going to be a family situation where the family's going to have to decide how they'd like to participate. We've been keeping up with them now for 3 years,
Hmm.
and we've been doing a really good job with over 90% completion. And this is from all the different sites, all the different places around the country. And it's a testament to the relationships that we've built with people, that they
Hmm.
really like coming back. Now they're going to have to learn how to do some of these neurocognitive tests at home, and we're going to have to watch while
Oh,
they do
okay.
them. And so we've had to revise some of the scientific um, principles of what we do and change some of the really important assessments to be able to
Hmm.
do them this way. But I think we're showing that we can do it. We can make those changes. We can be adaptable, and that's what our science is going to require over time.
Mm-hmm.
However we want to do wellness, however we want to do happiness, however we want to do, studies, we're going to have to be adaptable.
Mm-hmm. Yeah, and I think, possibly adapting what the new research questions will be. So,
Yeah, exactly.
um, have there been any new, research ideas that have been a result of kind of the new norm that we're in that maybe you hadn't thought about before?
There's a lot of great
Sure.
ideas. There's a lot of really creative opportunities. And as Associate Dean for Research, I get to see a lot of those
Mm-hmm.
ideas come across. And I do think there's going to be some really neat things to come out of this time period.
Mm-hmm.
It's gonna take a while, but there's people just thinking very creatively about
Mm-hmm.
how to do some of the things that they used to do, and that's what we all have to do, is put on these new hats and think of new ways
Mm-hmm.
that we can do the things that we used to do.
Sure. Yeah. So if you have any if there's a first year or an incoming student or maybe a PhD student that will graduate in the next 2 semesters, do you have any new wisdom to share with them, as far as research and workplace wellness and anything along those
Yeah.
lines?
Well, I think they're just going to have to go with the flow,
Mm-hmm.
and they may have been planning to do an internship someplace else, but there's no place like home. And I think that they should feel good about the fact that they're here in Gainesville, where it's nice, and the climate is great. People are warm and friendly,
Mm-hmm.
as is the climate. And also, we have lots of opportunities here that they can do right from the
Mm-hmm.
confines of their own home, and we
Sure.
can set them up with the tools, teach them some of the research assessments and some of the methods and protocols, and they can get involved in doing some of the things that they would probably and really enjoy doing, whether it's volunteering
Mm-hmm.
someplace, or if it's working on our projects here. There's a lot of things to do here at the University of Florida.
Mm-hmm. That's great. I guess we might close with this question, Dr. Cottler. So, as it relates to workplace wellness and health and well-being, both in research and in any type of organization somebody might be employed in, is there any one bit of advice or idea or parting thought you would want to leave with people?
I think it's that every single day, do something for yourself that will
Mm-hmm.
help you to um, enjoy enjoy the day, and
Mm-hmm.
do something to get out, whether it's a YouTube. If it's raining, you can do a YouTube inside or take
Oh,
a
sure.
walk. Do,
Yeah.
do something for your own health, and be happy.
Great. Well, I think that's a good place to start. Well, thank you for joining me today.
Thank you so much.
You're welcome.